And as I continue to say this dream, I would like to ask the following people to sit in front. Margaret Manase, Doris Frank, Professor Eligius Liamuya, to sit in front here, and Dean MacKenzie. These are the 4 people that I'm going to tell the story, and you will be listening about this story. It is a story about the dream that I had. But before I say about this story, I want to say something that happened 10 years ago. It's about a miracle cup, Kikombe cha Babu. This is something that even a young child heard about it. It's an older person who was living right in the middle of Serengeti, very far. It would take 24 hours driving to get there, very middle of the jungle. He claimed that he had a miracle concoction of herbs that cures all chronic diseases. So people with HIV, diabetes, they ran over there. And it was hundreds of people who went there. I couldn't imagine how powerful it was. Nobody was able to block that migration. I'm among the people who lost a lot of my patients. They even removed their drip. They said they wanted cure. And we couldn't. Actually, including my mother went. So it was a huge issue. But only one thing which I want to pose today that would cement my story is that people were looking for help. And 95% of those people had common health conditions, non-communicable diseases. And it was claimed that it has been failed, so they were looking for help. So the only one question that I want to ask is a group of religious people, because we work with them. Nataka kuuliza viongozi wa dini kuhusiana na safari ya Loliondo. But I also want to ask my fellow doctors, madaktari wenzangu kuhusiana na safari ya Loliondo. Kwa sababu wote kama ni hasara tulipata. Because if it's a loss, we did get a loss. I lost a lot of patients. They died because of lack of insulin, lack of medicine, while they were waiting. You would wait in a queue for 1 week before you get the Kikombe. But those who came back, they had stopped drugs. They died due to complications. And it was a massive. That is a question for we doctors. But for religious leader, I'm sure also our people we lost their spirit and soul while they were looking for that. So this is the question I want to pose today. Had we working together, would we lose that many people? Probably you have the answer. I haven't started yet to tell the story about these 4 people. Margaret Manase is my mother, sitting very, very close. I would never tell you about this story without this mother. She brought me in this world. So I was speaking English. She can get a little bit, but it's very okay. So you nurtured me, and I want to say thank you. Next to her, after my mother released, it's Doris Frank. This is my wife. So this is the person I quarrel the most than anybody. But we get along the most of the time. And when I get grumpy, this is where things go down. So this dream wouldn't be true without her. Thank you. Professor Eligius Liamuya. This is my teacher since from the first day I went to school, medical school. Let me tell you about Professor Liamuya. If you list today the most intelligent people, I have a lot of doctors here, 3 people in this country, the most intelligent, elite, respectable, academically acceptable, once they say a word. Of the 2 people, Professor Liamuya will be one. I want you to appreciate how important this person is. So he was my model when I was in medical school. And I used to walk and speak to him often. But this is the person I only spoke about the dream I had after my medical school. And I went to ask him in my 5th year, Professor, now I leave Muhimbili. This is who I want to see after 10 years. This is who I want to see. I spoke about what we are seeing today. Professor, he's told me very humble words, as you all know him. He said, always count on me whenever you need me. So I was feeling secured. And before I even went further, I found myself in a very special working environment at a community where I was asked to take care about people, taking care for people with the HIV. This is a community that were so suffering. By then there were no ARVs, there were no tests. Antiretroviral treatment were no longer universal. But I worked there for almost 10 years, and that's where I learned the power of the community. Because we used to live from one place to a remote area where people were so sick. I remember I used to carry a group of doctors, nurses who would carry the drug, and we would go very far to areas of Kisuyu and all that area. And sometimes we would run out of test kits, but we see people are sick. So we even started, I would say slowly, we started treatment without any testing. And we were so happy because after 2 weeks we come back and find these people can speak and come back and continue to test. So those were the miracle years. But what I remember, those people who were sick, they were brought by motorcycle, by bicycles, some people were carried. So I learned that the community has a power if they are empowered. And this is what I learned 10 years back. This was before I was even sent to Johns Hopkins. So after staying for almost 5 years, I started to get tired because all my colleagues went to school, they did their master's, PhD, and then they started to look at me and staring at me. Then I was like, what is this? So I said I must go back to school. By then, I was very much respected because I worked for HIV and people would ask me a lot of questions. But I learned one thing. When people ask you about the comment, before they shake their head and appreciate, they ask who you are. And with all the experience, whenever I give comment, they would never accept it 100%. So I learned that I must go back to school. So I was looking for a university that would give me strong education, that I can impact the community. The best school in the world. I was looking for a school that can influence the world, move the world. The school that has people that think day and night about protecting life. And if you put these words in the Google, the only school that will come is Johns Hopkins School of Public Health. So I applied for this school. So tell me what about this special school, the best one? Normally, they are the most expensive. You'll agree. So when I applied, I was very lucky. I got the admission. But then I looked at the bill. I said, no way, it won't happen. So I tried my best. I said, how will I go to Johns Hopkins so that we can move this world? That was my biggest question. So I started to write letters. I wrote to the Bill Gates and Melinda Gates. I wrote to De Beers. I think I even wrote to more. Like, I wrote to so many people who would probably, but I didn't get any support. But I also wrote to the World Bank. But the year passed, I didn't get the scholarship. The second year, I didn't get the scholarship. I was so disappointed that, oh, my dream is dying. The third year after I lost, then there was a special scholarship was given by USAID. Actually, USAID was helping me to go to those remote areas. So these were the scholarship criteria. We are looking for someone who has actually worked in the community, impacted the community over 5 years, not in the government, who has admission at Johns Hopkins who can support. I applied, but I didn't get the scholarship. I was so sad. So 4 years later, I received this phone call from the World Bank. We are happy we will take you to Johns Hopkins. And that's how I went to Johns Hopkins. I was happy just like you, but I was worried, will I again apply? Because it was very difficult to apply. Then when I went back to my office, I received a very special email from Maria Jane West saying that we will use your 4 years application. Just come. So that's how I came. So I joined Johns Hopkins, and I was in the hands of Dean MacKenzie. So when I was there, I was able to generate and write. Before I went, I could write and write grant maybe and mobilize resources. But also the very important lesson I learned, it was about effectiveness, efficiency, cost benefit, scalability, hypothesis, logic model, health system, community engagement, objective, and health behavior. Those are the things I learned at Johns Hopkins. So I came back with an inspiration of working with the community, with tools in my hands. And then we started the Community Center for Preventive Medicine. So I spoke to one of my teachers who was Professor Gilbert Burnham, who actually, he was very inspired by the vision and what I actually thought would be the fate of what I perceive to be our mission. So Gilbert Burnham told me, Frank, if you are going to do what you are telling me, we will all appreciate after 20 years. That's what he told. And he said, I will come to CCPmedicine whenever you start. So he came. And whenever he came, he found that it was like 1 month before I opened. David Peters, who is the head of international, also came. And he's the one who actually helped us to launch our mission, and that was very, very possible. So with this mission, and one of the most important things is to work with religious leaders and work with them, and we continue to impact the community. As you see, we continue. But one day, we started with the district commission. Dr. Sam was here, he's the one who opened this mission here 5 years ago, as you can see. But after that, we continue, and we had other people visiting us, including the Minister for Health, who actually came here to launch our initiative. And that was a sign that the dream is becoming true. We continue working with the community, and you can appreciate other people, including the religious leader, coming to our mission, joining us, and we did a lot together. But also 3 years later, we had the Vice President coming to our mission in the same ground. That was purely a sign that our mission is becoming true. We continue with the same, and it was this May when we were invited at the WHO where I met Health, and then he heard about the story, and then he said, we will come to see, and it has been true that you came. So as I continue to close my remarks, I would like to say, today I want to say thank you to these 4 people. So I will ask you to give a gift, a special gift, and ask you to continue to support this mission. But also, we have a special cake which we are going to cut today as a sign of victory of 5 years of our milestone. So I will ask these people to lead us on that. But also, I would ask Dean to issue certificate of appreciation to those people who have supported the mission. And these are the donors and volunteers and healthcare professionals who are sitting here. And that is the biggest thing I would like to ask. But I do have a very special request to the family of John Hopkins to join the hands to evaluate the model that we've already presented, but also, if possible, to mobilize resources so that we can get evidence. But this has been said by the Vice President, but truly we must have evidence to be able to influence the whole community to come up with our mission. So finally, I would like to say, we have seen this dream coming into pass. And what I think the hospitals that we have today should have the same picture as we are seeing, that every hospital should have a component of prevention while you have curative, but also we have to think about chronic care, and this should be under one arm. And someone who's working in the middle should know what's happening. They might be under separate roof, but I think it's very important to be in coordination of one person. And that is our dream, and that is what we envision to be the center for excellence that we request John Hopkins to join the hands so that we can demonstrate and come to the end and prove for our people. Thank you very much for listening, and thank you for coming.
Baba baba tu bespasanela